Hi, Mr. N. How are you today? My name is Lenore Capilouti. I know we've met before, and you know I'm a nurse practitioner. So, what brings you to the office today? Oh, you're here for your pre-op discussion about your trigger finger. So, explain to me what's been going on. You've had this trigger finger for about a year, and it's been getting worse. Um, How do you explain that to me? So, you have to actually, your hand spasms and you actually have to open your fingers because you can't open, once it happens, you can't open your hand by itself. How does that make you feel? Well, I understand it's uncomfortable. uh, can you rate the pain for me? So on the worst case, it's a 10 out of 10. What's the average and what's the best day? So four is an average day, and 2 would be the best day, huh? I'm sorry. Why do you think this happened? Explain to me. I understand you were a firearms instructor. Did you use your right hand a lot? Oh, I understand, yes. You're also left-handed. Do you shoot better with your left hand or your right hand? You shoot better with your right hand. Okay. Is there anything that makes it better? Not really. What makes it worse? Well, when it spasms, it gets worse. I guess so. And how long have you had the pain and this problem? For about a year now? Okay. And tell me a little bit about your family. And you have 3 brothers and 2 sisters. Are your parents still alive? Oh, your mom is still alive, but she's suffering from dementia. I'm so sorry about that. It could be hard for you too. A lot of stress. Your dad passed away years ago from COPD. Was he a smoker? No? It was, what caused it? They think it was related to his job. He was a printer. I understand the chemicals in that could cause that problem, yes. So, is there any other problems related to your hand that you want to discuss? So we can make a note of it. So I understand now that when it happens, you're getting this shooting pain up your arm as well, and that you're losing, you can't grip anything, and you're losing strength in your hand. Okay, I'll tell the surgeon about this. So how long were you in the military for? 17 years. And were you ever deployed? Oh, you were deployed to Iraq. Were you okay there? You were affected by an IED. What's an IED? Oh, an improvised explosive device. Can you explain to me what happened then? Oh, it hit your convoy and it blew you out of your Humvee. And you also suffered injuries to your legs and your knees, but you didn't have any broken bones or other injuries, no shrapnel or anything like that. You had your teeth replaced because of the clenching? It was just a reflex and you broke your teeth. Oh, that sounds terrible. Do you still like to shoot? You do, but you have to use your left hand because you can't grip with your right. That must be really irritating. I apologize for the inconvenience that this has caused you and how long it's taken you to get taken care of. Do you have any other medical problems, Mr. N? You have asthma? Oh, well, it was originally diagnosed as reactive airway disease, but was caused by a misdiagnosis, and you received the wrong antibiotics, and you had severe pneumonia for a month. You were hospitalized for that time? When was that? Oh, in 2000. So what do you, explain that to me now. What happens when you get sick? So you know when you need to go to the hospital and you have medication. What medications do you take for your asthma? You have an inhaler, and you also use the once a night medication. We'll get back to that when we go through all your medications. Did you have any illnesses as a child? Measles when you were 5, chickenpox when you were 7, multiple strep throats until the age of 9. Then what happened? Oh, they took your tonsils and your adenoids when you were 9. I guess that made you feel better. Have you had any other surgeries? You had a left elbow surgery, and what was that for? A torn tendon. And you had carpal tunnel repair in 2010 as well, at the same time. And you had digits removed, the second and third digit. You had 2 bones removed from your left foot and each toe. Okay. And then, most recently you had a right knee replacement. How's that going? So physical therapy is coming to take care of you, and you're doing really well. Excellent. When's your next follow-up with the orthopedic surgeon for that? Oh, in about a week or 2. That's great. I mean, you look like you're doing great now. Do you have all your immunizations? Oh, you do. And you even had your shingles vaccine. Excellent, excellent. I need to ask you about your psychiatric history. Any history of depression or anxiety, PTSD? Okay, no. Excellent. Very good. Do you have any allergies? You're allergic to horse and horse manure. Interesting. I've never heard that one before. What happens when you have an allergic reaction? So you still have difficulty breathing. So it seems that there's a few things that cause breathing problems. I noticed that your O2 saturation was a little bit low. Does it usually, what's the lowest that you ever had it? 80s? Well, it was in low 90s today. Is that normal for you? Okay. Just to make sure that we're on the same page. Because your vital signs were good, your weight is good, your pulse, blood pressure were excellent. So let's just review your medications. It's, you wrote down you take albuterol as needed. You use Advair and Singulair. You use them daily, correct? And you take them at night? Okay. Make sure that after the Advair, you make sure you rinse out your mouth. You know that. Okay, good job. You take an Ultram twice a day for post-operative pain, and that works well for you. Good. And I see Celebrex is also twice a day, 100 milligrams. Is that just after the surgery? Okay. And then you were told to use Tylenol with the Ultram for breakthrough pain. How's that working? That works well for you? Okay, good. They try to keep you away from narcotics. It's just there's such a big problem with addiction right now. And using Colace for constipation with the medications, is that right? Okay. So you haven't really had a physical since last year. It might be good to schedule a whole physical exam. Probably before your surgery if possible. I know it's a couple weeks from now. We could see if we can get you in then. If not, we could wait till about a month or two after your surgery and then you can have a whole physical exam. It seems that all of your immunizations are up to date. Your last TB test was negative. It was about 2 years ago. And you're not in a high risk area where you'd have to worry about that. You had your colonoscopy at 50. And then you have one again at 58. Okay, so it's usually about every 8 years, 8 to 10 years, so you're still good. Any other family history you want to talk about? Your mom has dementia. That can be very hard on your family. I know you're not close, but I know it's probably affecting you as well. But basically, she's fine. She has no other medical conditions, no high blood pressure, nothing, just dementia. Otherwise, she's a healthy person. Okay. And we already talked about your dad. He was deceased. He died from complications of chronic obstructive pulmonary disease. Did he smoke? No? Oh, he was a printer and it was the chemicals that caused him to have lung damage. Interesting. And what about your brothers or sisters? You have altogether 5 besides you? And they're all healthy, no problems. You're married? Oh, you've been married 4 times. And your children? You have 3 biological children, but you have 8 children. So 3 biological children and then all stepchildren, and they all think you're dad. Okay, that's great. You have a good relationship with them. That's amazing. Your kids are all healthy. Oh, your daughter suffers from asthma too. Is it more seasonal? Allergies? Okay. Any other communicable diseases or any other problems for you besides the ones that we talked about? No. Okay. So you're a United States citizen, huh? American through and through. Is there any spiritual or religious affiliation? Oh, you were raised Catholic, like most of us. A lot of us don't practice, but we still were raised Catholic. So tell me about how you feel about your health. How does this issue with your hand and the knee surgery, how does that affect your life? So you're moderately healthy and you're feeling better since your knee surgery. The pain is tolerable and you only take your medication when it's needed. That's really good. But you've had some changes in your appetite, you said. Why do you think that is? And you've lost some weight. You're not drinking any beer anymore. That's a good thing. Are there any restrictions that we should know about? You don't have any special diet you're on or anything. No, you eat when you're hungry and you're eating healthy. Vitamins, you're taking your vitamins every day. Excellent. Any problems with constipation since the surgery? Okay, so the medication, the Colace is working really well. You haven't had any issues. Good. So, Mr. M, where do you live? And tell me a little bit about your living conditions. So you're from New York, but you live in El Paso, Texas. That's pretty much of a culture shock. Oh, this is where you retired with your wife. So tell me about how that is. How do you get from Staten Island to El Paso, Texas? Oh, your wife was in the Air Force, and you went to Japan, and then you went to Guam in California, and then she retired, and you decided that Texas was where you wanted to retire, and that was where the job was. So you went to El Paso. And do you like it? Oh, you love it there. Do you live in a one-story house, two-story house? Oh, you have a large one-story house on a lot of land, and it's amazingly quiet, and you love it. This was your forever home now. Okay. So once you feel better, what do you think you're gonna do? Are you gonna go back to work? You're gonna look for a job trying to work with the police department maybe? As an investigator? Interesting. Have you ever been exposed to any toxic chemicals or any other things? Oh, you were exposed to the burn pits in Iraq. Yeah, that's an issue because that could affect your lungs. So, there's a class action suit against that. You did know, so you are a part of that. Okay. Since your surgery, have you been doing anything that you should probably not be doing? Trying to move around more than you should maybe, and you're hurting yourself? Oh, it's the physical therapy that hurts. They're torturing you, is that it? 3 times a week. That's pretty intense. And they come to the house, and you also have a home health aide, and a nurse that comes to visit you at your house. And that's really good. Do you have any family in El Paso? No, just you and your wife. How about neighbors? You talk to your friends? Or, you have neighbors next door. That the gentleman went through the similar surgery, and he's interested because your recovery is going much better than his was. Is that it? I understand. He's jealous. He doesn't know. Yeah. He's like, why is his easy and mine wasn't? Okay. So, your wife found a job in San Antonio. How do you feel about that? Oh, once you're able to drive, you're going to go back and forth. And she's going to fly home for weekends. Oh, okay. And, do you have any other problems with your memory? I mean, you said your mom had dementia. Are you experiencing any signs or symptoms of that? No? You have a good memory? Oh, you remember everything. Yes, you can quote movies. Okay. I think that's a guy thing. Do you take naps often? Oh, you're taking less naps since you had your surgery. Why do you think that is? you were in so much pain before you just didn't want to move, and you just, like, that was an escape. And you weren't sleeping at night, so you would nap during the day. But now you're getting better night's sleep. You're sleeping up to 8 to 9 hours a night. That's very good. I'm glad you're feeling better. And you have an adjustable mattress that you bought, so you can position yourself different ways so you're more comfortable. Oh, you bought it because of your breathing. And if you sit up at night in the bed, you can breathe better. That's really good. What's the most important thing you're doing right now? Or you're just focusing on your physical therapy and just trying to get your knee better? Are you able to go in your pool? Just recently. Okay, the doctor said it was okay to go in the pool and just move around. That's probably less uncomfortable for your knee. So before all this surgery plans and everything, what did you enjoy doing? So you have an RV, okay, and you drive it. Nice. Where have you traveled in your RV? Oh, you went to Yosemite. That's when you were stationed in California. Did you enjoy that? Yeah, it was beautiful, right? How did you like Guam? Oh, you didn't. It was too humid. Well, when you go visit your wife in San Antonio, be prepared because it's pretty humid there. Do you smoke, drink, or use any illegal substances? So you just told me you cut down on your beer intake to basically none, and you don't smoke, and you've never used any illegal drugs, which is awesome. Have you been experienced any intimate partner violence in any of your marriages? No, just some verbal abuse from your one wife. Oh, and the last one before this one, she was an alcoholic and drug addict. It sounds like you're kind of the savior person, and you couldn't save her. I'm sorry. Do you have any stress, or how do you cope with stress? I mean, there's been a lot of changes in the last 2 years in your life. You moved from California in the last 2 years. You sold a house, you bought a house, you're remodeling a house. And your family is basically on the East Coast. Your one stepson is in Nevada. Your girls are upstate New York, Long Island. And then your stepdaughters are in Florida. Your stepson is in Florida. And your other stepdaughter's in New Jersey. That was 8. Do you have grandchildren? You have 20. Wow, that's a lot of grandkids. Well, nothing compared to your 57 first cousins, I guess, huh? Big family reunions. Loud. So you think, what helps you cope with things? Listening to music helps you cope. So that was one of your coping mechanisms, you tell me, when you came home from Iraq and you were upset and didn't know what to do, and nobody knew what you were going through. Music was helpful. Do you play any instruments? Oh, before your hand problems, you were learning how to play the piano. Well, that's good therapy when you go back. you can use your fingers again. Oh, when you listen to music, you like to sing along. So when you're in the car, people can hear you from like blocks away. That's funny. Well, as long as you enjoy it, that's all that's important. When you were in Japan, they called you the singing lawnmower man. That's pretty funny. And the kids were upset because you were leaving. That's so sweet. Okay. You're sexually active? Well, you were more sexually active before you had knee surgery and pain and all of that. So hopefully you'll get back to a more normal life now. That you're feeling, once you're feeling better. So we're just going to go through a general review of your systems. Okay, we're going to start from like head to toe. So generally we talked about some fatigue that was prior to your surgery, and the fact that you've lost weight since the surgery because you haven't been eating as much and you're moving around more. Okay. Do you have any rashes or lumps or discolorations on your skin? Any moles that are concerning or that anybody's told you about? Okay, so the only concern right now is the surgical incision on your knee, and it's healing well. There's no drainage. Okay, the surgeon said it looked good. There's no signs of infection. It's not red, it's not hot, it's not swollen, or it's obviously it can be a little bit sensitive to touch, but it's not painful as it was before. Okay. Have you had any headaches or dizziness? No. No history of vertigo, nothing going on like that. Okay. And any long-term effects from the IED explosion? Oh, just the repair on your teeth. Okay. When was your last eye exam? Oh, 2019? And they gave you glasses for reading. Okay. Any problems with hearing? Did the IED cause any tinnitus, lasting tinnitus? Or any hearing loss? Oh, you've been tested and there's nothing. Your hearing is fine and you don't have any history of tinnitus? That's kind of just a ringing in your ear that doesn't go away. Okay. What about your sinuses? Any colds or congestion? You haven't had any upper respiratory infections recently that caused you to go to the emergency room? No, the last one was a couple years ago. Okay. How do you know you need to go to the emergency room? Okay, he told you that if you have difficulty breathing and more shortness of breath and productive cough, that you should go to the ER and tell them that what you need to have happen. Okay, thank you. Any problems with your gums, bleeding? I know you said you had teeth replaced. They're permanent replacements and they're posts. Oh, you recently had a root canal for a toothache? Okay. And you're feeling fine now? Awesome. And I know you had your tonsils out at 9 years old, and you haven't had a sore throat or anything like that since then. Ear infections, none. Any problems with swollen glands anywhere on your neck, under your arms, in your groin? No? Okay. And no breast lumps or any changes in your breast tissue? I know that's a silly question to ask, but men can get breast cancer as well, so you should check. And we know that you have wheezing. You told me that. you have problems with your breathing. If you don't use the Advair, it gets worse. Is it in your chest? Okay. No, it's more in your throat. But since you lost weight, you're telling me it's much easier to breathe and you've had less wheezing. That's great. And again, the reactive airway disease was diagnosed after Iraq. And the burn pits. When was your last chest x-ray? A year ago. And there were no changes. What was the recommendations? That you follow up in another year, every 2 years, get your chest x-ray? Okay. Unless there's a change. And your tuberculosis test was current and it was negative. Okay. No chest pain. No. Okay. Any muscular chest pains from trying to do things that you haven't been able to do? No. So your appetite's decreased and you're eating less than prior to surgery. Do you think that was because maybe you were just depressed that you couldn't do the things you were doing? You don't have any reason. You're just not hungry. Okay. And you're not eating because you're not hungry, which is a good thing. And you said before that because of the colace you're taking, when you have taken any narcotics, you haven't had any constipation, which is a great thing. So, and your last colonoscopy we discussed was within the last 10 years. Okay. You've been drinking a lot of water, so that makes you get up more at night to urinate. Okay, well maybe we can talk about that. And I know it's good to drink a lot of water, but maybe try to limit it to a certain time of the day so that it doesn't keep you up at night. No history of blood clots, and you've never had any problems after surgeries. Okay. You're not on any blood thinners? No. Your leg was red and peeling, but it's getting better? Did they have any reason why that happened? Oh, they think it was an allergic reaction to the infective medication that they scrubbed your leg with, maybe betadine or Hibiclens. Okay, it was just a reaction. All right, and you had no varicose veins, nothing like that. All right, thank you. Any other, I know you've had joint pain before, but when they did your knee replacement, did they find any arthritis? No, okay, well that's a great thing. So it was related to your injury from Iraq, you think? Well, that's your best explanation. Okay. And no neurological problems, no syncope, you're not dizzy. We went through this before, and you said no. No bleeding disorders, no history of anemia. All right, thank you. And any, have you ever tested for diabetes or thyroid disease? Oh, you've had all that blood work, A1Cs and everything came back normal. Excellent. Any history of depression again? Nothing. But you feel sad, okay, when you remember about being deployed, or if you see something that reminds you, that trigger, you feel sad, but it's not depressed. And your memory's fine. Oh my gosh. Okay, well I don't remember the first thing I said to you, but I guess you can remember a lot because you just remembered everything I said to you, and that was half an hour ago. So, Mr. Neese, it was Mr. N. It was very nice to speak to you. Dr. X will be in a minute, and I'll go get your forms for your surgery ready. They'll go over the explanation of everything, and you can get the paper signed for the consents before you go to the hospital, and you can, we'll give you a package with what you need to do before surgery. It was very good to see you again, and I hope your surgery goes well. You're doing great, and you look good. So please take care of yourself. Bye-bye.